when the doctor refuses to give a particular treatment that the parent or the child is requesting. So by the end of the talk, we'll go through all of this, and then I'll give you a short example of a child's history that we're dealing with at this point. Okay, so when we're talking about refusing treatment, we're really talking about first assessing the person's capacity to either accept or refuse treatment. And capacity, as you see defined here, is your mental ability to carry out or be subject to legally recognized acts. So whether you're making a will, whether you're deciding to get married, whether you're buying and selling property, or in this particular case, we're focusing on this morning, accepting and refusing treatment. So it all comes down to your mental ability to do that. And there's some general principles that we follow when assessing capacity. First of all, it relates to a specific decision at a specific time. So because somebody is capable of deciding whether, for example, they want to have surgery, doesn't mean that they're capable of making every decision thereafter. And because somebody decides this morning that they don't want something, does not mean if you come back this afternoon at 5 o'clock, they will also be deciding they don't want something. So the point is, you have to be very careful that for each decision that you're assessing the person for, at a particular time, these things can change. So we heard about how painful sometimes these surgeries can be. We've heard about how anxiety-provoking it can be. So if you're in pain or you're very anxious, then you may not have the ability at that time to make this decision that's in your best interest. So it is our role as